Can GLP-1 medications cause thyroid nodules or thyroid swelling? Now, since we're talking about thyroid, you all know that thyroid exists in your neck. And if you're noticing a lump, it may not just necessarily be a thyroid lump. If you're experiencing on the sides, it could be your lymph node. So here we are specifically talking about a thyroid nodule and thyroid swelling, not necessarily a neck lump. When we have thyroid nodules, and these are either biopsy proven benign, then there is no contraindication that you cannot take GLP-1 medications for the medical indications that you need GLP-1 for. GLP-1 medications by itself, we don't have any data, any evidence that it is going to lead to thyroid nodules. I would recommend to, again, look at the answer number 1, where we talked about thyroid cancer and different types of thyroid cancer. So when you have a thyroid nodule, it could be a 2 millimeter nodule, it could be a 2 centimeter nodule. There's a vast difference. Most of the thyroid nodules are usually benign. They are different sizes, shapes, their appearances vary on ultrasounds, and that's why it's important that you see an expert, an endocrinologist. If you have a thyroid nodule, get the right management treatment or a follow-up, or it's also called as surveillance if there is a concern before you decide to start GLP-1 medication. But we don't have direct evidence where GLP-1 medications are causing thyroid nodules or even thyroid swelling. In general, you also want to remember thyroid nodules are just common. They're common in the thyroid gland, and there is no recommendation from our guidelines to do a screening thyroid ultrasound if you're taking GLP-1. A simple clinical examination done by your physician is usually adequate. So by itself, I wouldn't build on the fear or anxiety that the GLP-1 medications are leading to a thyroid nodule or a thyroid swelling. One important necessary step that I would highly recommend, that if you're going on GLP-1 medications because you have diabetes or there's insulin resistance and you're preventing type 2 diabetes and you have obesity or other predisposing risk factors that make you eligible to take these medications, it's very important that you get your basic testing done, which also includes a thyroid hormone evaluation, specifically thyroid stimulating hormone, and if it's needed, a free T4. So you have a baseline understanding of what your thyroid functions are before you're considering these medications. And that's just a simple screening process, not just because you're starting GLP-1, but it is actually one of the important hormones that we tend to test in the metabolic world. Also for annual women's screening, it is so crucial that you all should be aware as an adult as to what your thyroid hormone levels were. If not, request your primary care physician or your physician to at least add that in your annual checkup in case of either any symptoms or if you are dealing with a metabolic condition like obesity, diabetes, fatty liver disease, and so on.